I have decided to do breast cancer as my presentation. Um, 1 in 8 women will be diagnosed with breast cancer in their lifetime. This is the second leading cause of death, cancerous death in women. Breast cancer, it occurs because of cells in breasts. They grow abnormally. Sometimes they grow out of control and they invade the surrounding tissues. This is referred to as invasive breast cancer. These cells divide more rapidly than the healthy cells and continue to accumulate. Breast cancer occurs because of interactions between external factors and a genetically susceptible host. 90% is genetic abnormalities, which happen as a result of aging, the aging process, and your lifestyle. DNA mutation is inherited or acquired. It could go either way. Um, it can begin in different regions of the breast, such as the ducts, the lobules, or tissue in between. Damaged cells replicate and create more damaged cells and then and tumor growth. Your body's hormones and chemicals can accelerate the growth, and lymph nodes and your blood vessels then can carry the cancer to other areas of your body. Um, some risk factors of breast cancer include obesity, age, hormone replacement therapy, um, having children at a late age, or none at all. You can have a history of cancer in your family, and of course, genetics. According to the NCBI, 5 to 10% is linked to gene mutations inherited by your parents. Um, a few of the different symptoms of breast cancer include a lump in your breast tissue, a dimpling in the skin irritation, red scaly patches on your skin, swollen lymph nodes, or a constant pain in your breast area or your armpit area. Of course, if any of these symptoms are suspected, I mean, these are symptoms of several other things. So being diagnosed by your doctor is recommended. You'll want to go in and they have different options for diagnostics. You can get a mammogram, which is a special x-ray that will look for abnormal growth in your breast tissue or changes in that tissue. Um, there you have breast ultrasounds, and those distinguish um, a solid mass, which is typically cancerous, or if it's just a fluid filled cyst, which is typically not cancerous. Um, if any occurs, you may have a biopsy of this suspicious mass. They will remove the cells in it and send it off for testing. If you were to acquire breast cancer, um, they will run MRIs or a PET, and this will show us how far it has spread, how much is spread, and if it has spread to other organs of the body. Um, there is management, some management for breast cancer. Of course, this all depends on different factors. A couple of those is the stage of cancer and the age of the patient. Uh, Surgery is always recommended after being diagnosed. They may remove just a part of the tissue, or they may have to go in and remove the whole tissue. After surgery, they may require radiotherapy. Radiotherapy will go into that region where the tumor bed had laid and will get rid of any of those microscopic oh, tumor cells that may have escaped the surgery process. After that is done, there are a few medications that may be taken. They have a hormone blocking therapy, which those in some breast cancers, uh, estrogen is needed in order for those cells to keep producing. So if you take these meds, it will stop the production of estrogen, which will slow the process of the spread. And then, of course, there's chemotherapy and oh, chemotherapy and targeted therapy, and those all are helpful management after surgery. Um, and then, of course, as stated earlier, it is a um, mutation that may be inherited, but it may be acquired. So, a few of the preventions that we can do to slow the spread of it or stop it before it gets too far or prevent would be being self aware of your body, knowing, your body. I know in women, as like my age, I go yearly to be checked. I have a yearly appointment with my doctor, and she examines me. Of course, if anything were to come up through her examining or through my examining at home from me being aware of my own um, body and stuff, they may go on to screening. You can get screening. Um, and as always, with any health issues that we face in today's society or you know, um, we always want to remember exercise and maintaining a healthy weight and having a healthy diet. Those are all helpful preventions in stopping the spread of breast cancer.